If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com. That's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Now, Lyme disease is spreading across the U.S., and experts expect to see the number of patients infected increase in 2017. For example, in Michigan alone, cases are up 500%. Hi, I'm Robert Harriman, and this is Outbreak News Interviews. Now, Lyme disease-carrying ticks are now present in half the counties in the United States. For example, in Pennsylvania, health officials say the black-legged or the deer tick is found in all 67 counties in that state. Now, one of the main issues with Lyme disease is the testing or the diagnostics to diagnose Lyme disease. Well, joining me now is Richard Marconi, PhD. Dr. Marconi is a professor in the School of Medicine at Virginia Commonwealth University Medical Center, and he's the inventor of the Global Lyme Diagnostics platform, the GLD Test. Dr. Marconi has 25 years of experience in the study of pathogenic spirochetes. Dr. Marconi, welcome to the program, sir.
Nice to be with you, Robert.
Yes, sir. Well, as I said in the intro, Lyme disease is spreading, and in 2013, the CDC said there's about an estimated 300,000 plus cases each year in the U.S. So from your vantage point, how big is this problem, and how critical is it to get good diagnostics?
Well, the Lyme disease problem is truly one that is just, as you've already indicated, increasing dramatically with time. And I'd like to point out that it's not just a United States problem. It is a problem throughout the entire U.S., much of Europe, and of course it extends up into Canada as well. One of the key problems that we've dealt with in terms of dealing with Lyme disease is both developing better preventative strategies and also, very importantly, developing better methods for diagnosing the illness. And what we have learned over the past 20 years or so is that, in general, clinician faith in the current diagnostic tests is somewhat limited, and we really need to advance the state of the art and develop new tools that will allow us to detect the infection both earlier, but also, very importantly, that will allow us to detect infection with the many different types of Lyme disease strains that exist in nature.
Now, one of the major issues, of course, is the limitations of the available assays today. And Dr. Marconi, what are the problems of the currently available tests available for Lyme disease?
Well, one of the key problems, again, is simply that physicians really do not feel very confident in the results that are obtained with these tests. Almost all the tests that are currently being used are based upon detecting antibodies to the Lyme disease spirochetes in the blood of an individual that has been exposed to the bacterium. And one of the problems associated with detecting these antibodies is that our approach to date has been perhaps too narrowly focused. What we learned many years ago in the Lyme disease field is that the Lyme disease spirochetes are remarkably diverse in nature. So what I mean by that is they vary quite a bit in terms of the proteins that they produce when they infect a human, and also in just the general identity of the specific proteins that they're producing. So an antibody response that develops in one individual might not be detected by the tests that are currently being employed to screen for Lyme disease or test for an infection.
Now, with your years of experience and research, you developed the GLD test that's sold by Global Lyme Diagnostics to address the shortcomings of the current test. Dr. Marconi, what is the principle of the GLD test? How does it work? What's the science behind it?
So the GL test is a serological test, much like the current test that exists on the market, but it has several innovative aspects to it that, again, allow it to detect the very diverse strains that we may become exposed to from nature. And the way that we approached developing this test was, rather than use the traditional approach of taking a single protein or a small group of individual proteins to screen for antibodies in a potentially infected individual, what we did is we designed a brand new class of proteins that we call chimeratopes. Chimeratope stands for a chimeric epitope-based protein. And to break that down a little further for you, the portion of a protein that triggers an antibody response during an infection is a part of the protein that we refer to as an epitope. Since the epitopes that elicit antibody responses can vary a lot from strain to strain, that is really the big challenge in developing a test, is you need to develop a test that will detect antibody responses to these variable epitopes that are being presented to the human immune system during an infection. So rather than take a single protein, we actually created in the laboratory a protein that consists of many different epitopes from many different variants of some very specific Lyme disease proteins, and we link them together, hence the term chimeric. So these proteins are a string of epitopes joined together, and the power of the technology is that it allows a single protein to be used to detect antibody responses that might be elicited against the many different strains that exist in nature. And that is a real key difference between our technology and others that have come before us.
So what's the sensitivity and specificity of the GLD test? The concern with false positives and false negatives?
Well, currently, to date, we have really conducted our analyses largely based upon clinical samples that have been provided to us, and also based upon analysis of infections in other mammals, including canines. So to make a definitive statement regarding the specificity and the sensitivity, we'll really await further testing of a larger cohort of well-characterized serum samples.
Okay. Now, the GLD test is a testing tool, but is this also a good screening tool for Lyme disease?
Well, let me start by saying that I think screening for Lyme disease is a very important thing to consider and pursue. One of the challenges, of course, with Lyme is not only diagnosing it, but also treating it effectively. But if we develop better diagnostic assays that can pick up the infection early, then we can certainly simplify and ensure better success with regard to treatment. So rather than wait for symptoms to develop in an individual, I'm an advocate of screening individuals to determine if they have been exposed to the Lyme disease spirochetes so that we can initiate treatment earlier and therefore have better clinical outcomes.
What's the sample type for the test?
The sample type is a blood drawn from an individual, and we collect the serum from that blood, and that is what is used to screen for antibodies to the Lyme disease spirochetes. Okay,
and if the GLD test comes up positive for Lyme disease, is there a confirmatory test that needs to be followed up, or how does that work?
We consider the GLD test to be definitive in itself in terms of demonstrating an infection in an individual. So another confirmatory test is not required and not necessarily even recommended. I think the important point is that once one can demonstrate that an individual has been exposed to the Lyme disease spirochetes to the point where they are eliciting an antibody response to the bacterium, the next prudent step would be to advance directly to treatment and prevent the infection from taking hold and becoming a long-term chronic problem.
All right. Dr. Marconi, is there anything I left out that you would like to add?
Well, again, I think it's very important that we consider screening as a very valuable and powerful tool to prevent Lyme disease and prevent it from becoming serious in individuals that are exposed. And as you alluded to earlier, we know that Lyme disease is dramatically spreading, and it certainly has increased even since those numbers were released by the Centers for Disease Control back in 2013. It's important that we have a test that clinicians can rely upon and feel confident in when they're trying to make an assessment of whether an individual has been infected with the Lyme disease spirochetes or not. At the present time, a significant part of the diagnostic criteria that are used are really clinically based criteria, where one simply assesses the symptoms that an individual presents with. And again, by the time an individual presents with symptoms, the infection has already taken hold, and we're sort of playing catch up in trying to prevent disease from becoming more significant in those individuals. So I think screening and more accurate diagnosis is very, very important and is really the key to helping to address the Lyme disease problem, not only here in the United States, but as well in other parts of North America and Europe as well.
Okay. Well, for more information on the GLD test, including how to order it, you can visit Global Lyme Diagnostics at glymedx.com. That's glymedx.com. Or you can email them at info@glymedx.com. Dr. Richard Marconi, thank you, sir, for your time and expertise. I appreciate it.
Thank you for having me with you today.
Okay, thanks.